When it comes to other things like worrying, feeling anxious, it's very normal, especially at this time. But we also want to ensure that you don't lose motivation to be able to take care of yourself. I'm Dr. Fatima Angelica B. Campagna. I'm a consultation liaison psychiatrist. Well, there are a lot of challenges that we are all facing right now with regards to the pandemic, but particularly with diabetes patients, we're pretty concerned with access to care. A lot of our patients are unable to see their doctors and are able to do the required laboratory workup to be able to continue their treatment. But definitely, we have to adapt to what we call the new normal.
Hi, I'm Miss Annabel Garcia, 56 years old, and 15 years of service to the institution. My present position is the Assistant Nurse Manager of the Nursing Service Division. Currently, I am a person with diabetes, DM2, and this was diagnosed 12 years ago. And when I found out that I was a diabetic, there are so many adjustments and I experienced some anxieties. There are many more restrictions because there are many changes with regards to the physical activities that I do in my daily life. I also have to comply with medications and treatments. There are so many diet restrictions. In the light of this COVID-19 crisis, I experienced anxieties, most of the time also depression, because during this period of pandemic, there are some disruptions on how can I consult my endocrinologist, the other doctors that are related to treatment of my disease. I have to find options on how can I connect or have communication on how to manage my own disease process.
It doesn't mean that if you're not able to see your doctor physically that we will discontinue care. So as much as possible, if you have a trusted endocrinologist, you try to access or try to communicate with them through teleconsultation or even phone consultation. Or if it's really needed, try to still continue to see your doctor at the clinics. It's very important that you also try to have a structure. No? You're not able to go out as much, but it doesn't mean that you discontinue your typical activities which are recommended for diabetics. Now you're just limited to your home and you have to be able to do some form of exercise regimen in your home. So important to also have adequate sleep, making sure that you have activities that sustain you. So whether in terms of work or also leisure activities, we spend a lot of time at home. So we tend to lose track of what we need to eat, the kind of food that we should be eating. Maybe it would be good to engage with your family members, ensure that they support you in terms of maintaining a healthy diet. And of course, as with everyone, we all need to maintain a healthy diet, especially during this time. It's important to look for trusted sources. So maybe looking at, for the Department of Health or maybe at the World Health Organization. There are a lot of websites with information regarding diabetes care. I actually also would like to recommend that to limit social media use at this time because that can actually increase anxiety with a lot of information that we are imbibing. But if you're already very concerned, I still would recommend that you try to communicate or reach out to a trusted endocrinologist so that you can make sure that you are actually diabetic. And if you are already suffering from symptoms, it's important that you be able to access care as soon as possible.
The most important is that the support system that we get from our co-diabetics, from our families and friends, and from our doctors who are very supportive to us